Welcome to the American Academy of Grief Counseling's Videogram on complicated grief and depression. Sometimes grief becomes something not natural in itself, but it becomes pathological in its very nature. Complicated grief is that type of grief when a grief reaction goes wrong, or in some cases, where grief exists without a reason. There's no loss at all. It's just there's a feeling of grief that overcomes the individual. So, what causes complicated grief? Also, depression and so forth. And usually it involves, if we're not dealing with a depression with no reason, but a complicated grief reaction usually is a cause due to something that is irregular in itself. The trauma is extremely severe. It's a tragedy. Something happens unexpectedly, possibly multiple losses at once within a 1 month period. What we would also call a unnatural loss. An unnatural loss is a loss of a child. You're not supposed to lose your child. You're supposed to go before your child. So that's kind of what we mean by unnatural loss, or an unexpected loss. Someone's completely healthy in your life, your uncle, your friend, and they die in a car accident, unexpected. In some cases, it's a disenfranchised loss. Individuals don't respect your pain or your grief, or there's a stigma attached to it. Suicide sometimes has that stigma. Sometimes relationships in the past that were not considered conventional. If something bad occurred in that relationship and someone died, there would be a disenfranchisement to that itself. Also, within the individual's subjective ability to cope, poor coping habits can lead to complicated grief. So the loss and circumstances surrounding a loss, if they're really horrible and painful, might be too much for an individual to process, to handle, and to recover naturally. And that's when professional help is needed. Depression is one of those types of loss griefs that occur due to a complication in your recovery process. But depression can also be something that has no cause. It just exists in itself. And this could be due to brain chemistry and the neurotransmitters within the brain, hormone imbalance, or inherited traits. So not every depression is a result of something. In fact, many who are depressed due to nothing at all, except just something that is imbalanced within themselves. So if we're looking at depression as a result either of severe trauma and a poor reaction to that grief, which becomes in essence a complicated reaction then, or if we're dealing with depression for no reason at all, there are some symptoms that we can look at, that we can identify in an individual. For purposes of depression, the ones that are listed, if there are 5 or more of these listed within at least a 2-week period or longer, you can pinpoint that there probably is some form of depression taking place. And on this list, we have prolonged emptiness. Second is irritability, anxiety, and outbursts. Third, loss of interest in activities and hobbies. Fourth, sleep issues. Fifth, lack of energy. 6, reduced appetite. 7, worthlessness and guilt. 8, lack of concentration. 9, headaches. And 10, suicidal thoughts. So those are 10 good symptoms that we can, not good, but symptoms that we can really utilize as a diagnosis towards depression. If there's 5 of these or more within a 2-week period in itself. So there are other types of depression that can occur. There's major depression disorder. There's persistent depressive disorder. There's bipolar depressive disorder. And in bipolar, it oscillates. The individual can be extremely happy at one point in a week and then crash into the opposite emotional pit of despair later in that week. Seasonal depression disorder is also a common type of depression where it goes with winter, or it can be in summer, but usually it's displayed with the weather, winter. But some individuals, they can display seasonal whenever it best manifests for them. And finally, postpartum depression. Postpartum depression is obviously after a woman loses her baby through miscarriage, or immediate death after birth. It can also be for a child that is born completely and totally fine. There can be a postpartum depression, no longer being pregnant, and so forth. And this can also affect the man too, the husband in the relationship. Not just women suffer from postpartum depression after the birth or a miscarriage or a death of a child. It can also occur with the man as well. Depression, though, we know does require help. Untreated depression can lead to serious problems such as cutting, mutilation, drugs and alcohol, and for some, unfortunately, attempted and successful suicide. So it's important to find help through family, friends, and a qualified professionals. Grief counselors can guide, but once a grief counselor who's only certified discovers depression, it's important that they refer the patient to a licensed counselor or a psychologist or a psychiatrist, who in turn can then prescribe, if needed, medication ranging from Prozac to Paxil to Zoloft. But there's more than sometimes just medicative treatments. There's also grief therapy that licensed professionals can do. Cognitive therapy, such as cognitive processing therapy, that helps the patient look at their own issue from a conscious standpoint, to help revise and understand the particular loss that they might be going through. And there's also EDMR for severe trauma, eye movement desensitization and reprocessing, where the individual refocuses on what happened to severe trauma while looking into a light where the professional then helps them reprocess and understand that loss and trauma. So if you're interested in helping those process grief, and even interested in helping those at a greater level by referring them to the licensed professionals they need when complications occur in the grieving process, as well as depression, then please review our program from the American Academy of Grief Counseling. We have a 4-year grief counseling certification program. It's a 4-year tenure until it needs to be actually renewed. So it lasts 4 years, but before becoming certified, you need to take the required 4 courses, which you can take at your own speed, your own pace, and work through the actual program until you're ready for that 4-year certification. There's more information on that below with the link, as well as a request for information link. If you'd like to contact AIHCP, we can be reached at 330-652-7776. Again, that number is 330-652-7776. You can also email us at info@aihcp.org. Again, that's info@aihcp.org. Thanks for listening today, and I hope you have a great day.